Great. Welcome back to the House Healthcare Committee. It is still Friday, the 10th, not the 16th, and we are continuing our testimony on suicide prevention. Today we have with us Paul Henning, who will share his story, just as earlier we have had Desiree, and we'll have two more people after. So we have about half an hour. We're going to introduce ourselves so you know who you're talking to, and then we'll turn it over to you for introductions and to tell your story.
Okay.
Here.
Great.
Art?
Yes, my name is Art Peterson. I represent the town of Clarendon, Wallingford, West Rutland, Rutland Town.
Hi, Leslie Goldman. I come from Wyndham 3, which is Rockingham, Brookline, and Westminster, Bells Falls area.
Laurie Cordes, Lincoln, Bristol, Moncton, and Starksboro.
And I'm Topper McClellan. I live in Barrytown, represent Barrytown, and a part of Williamstown.
And I represent Essex Junction.
And I'm Melissa Black, and I represent Essex.
Alan DeMar, and I represent Enosburg and Montgomery.
I'm Bobby Farley-Strubia. I live in Barnet, and I also represent Waterford and Reigate.
And we probably will have another member come in eventually. She'll just sit down and start listening. So if you introduce yourself for the record, and then please share what you would like to share.
Yeah, I'm Paul Henning, the husband of the law professor, late Cheryl Hanna, and I'm going to sort of tell my story of that journey that ended in her death via suicide from buying a handgun over a weekend. So it really was like about a 3-month affair. She had normal mood swings like anyone, but one day in late May, she came home from the law school. And the law school at that time, Vermont Law School, and still may be for that matter, I'm not sure, was really undergoing a lot of financial stress. And she was part of the team, that was doing their best to keep the law school afloat. And she had a particularly hard day, got home, said, I cried all the way home. It's just been a terrible day. And that was a little unusual. And her anxiety from that point was higher than usual. And, when a suicide happens, you tend to look back and you look for reasons. We had a leak, there was black mold, certainly the stresses at the law school. She sought her gynecologist at one point. There was a change in birth control due to the concern over breast cancer. But soon she began not to sleep well, and soon after that. And so immediately she went to her primary care provider, and with a battery of recommendations of therapy, he gave her some medication to improve her sleep, which it somewhat did. And she began seeing the therapist. The therapist also gave recommendations such as yoga, meditation, and things to help her calm down and not focus on some of her stresses. Soon the therapist and the primary health provider were talking together, and she was put onto some antidepressants because she was depressed. And I want to make sure I'm getting everything. Yeah. At times, she was going and seeing her therapist twice a week, in fact. She did not want to be sick, was doing everything within her care to take care of herself, her family, herself, and try to be well. And I was doing everything I could to help support her in that. But her sleep continued to be really restless. Maybe I'll go to a crib note now. She still wasn't doing so well. One day in sometime in June. She came home and told me a terrible thing. Maybe I want to lay the groundwork to this a little bit. I think she was at sometimes impulsive. Certainly, she had this ability to be kind of a worst case scenario thinker. On our honeymoon, we almost missed our flight to Spain. And I remember running to the gate and she's crying, you know. And within seconds later, we're in the plane and she's laughing, right? But that's a little bit the way she was. And, you know, and I'd be like, geez, that's hard on the brain. Why do you think that way, you know? And she would say, that's the way a lawyer needs to think. And it's true. And it's part of what made her a great lawyer, because she had all the bases covered. But so she had the capacity, just within her normal personality, because that's what I determined this was, to kind of go to some extremes to some degree, you know? And one day she came home and she sat me down and didn't hide what she had just done. On her way home from the law school, she had pulled into a gun shop. And just after pulling in, a policeman pulled in. And she knew what she was doing was wrong. And she pulled right out of there and came. But she was freaked out. And she was telling me, like, I went to this really dark place. I pulled in there, and as soon as the policeman came, I left, you know. And it was then I realized that, wow, we need to keep an eye on her all the time. And we need to get all these health professionals talking together and possibly even seek some stronger actions, right? So, you know, I'm taking care of the kids. I'm missing some work and trying to keep an eye on her with the collective recommendation with some friends. I began I talked to her primary and her therapist, got everybody sort of in agreement. Let's try to get her up to UVM. I think she needs to be hospitalized. Well, Cheryl knows the laws, and she knows if she's admitted against her own will that she can't decide to get out of there. And she really wanted to control it, because worst case scenario to her is that people are going to see her a public figure as somebody with mental illness. She's going to lose all her credibility, right? So it was difficult to get her to agree to admit to go into the hospital. And we sure felt sort of stupid after she got in there, because there were no rooms in SHEP 4. And so her first night was spent in the ER. And she's like texting me and calling me, there's people screaming all around me. This can't be good for me, you know, and of course not, right? And I'm thinking, wow, okay, maybe she really didn't want to be there. But we kept pushing and said, look, they're trying to get a bed ready. They're trying to get a room. You'll have your own room. And we finally, so she came home, she went back, and she got her own place there. But really, the way she was feeling, she wasn't really uncomfortable no matter where she was. She always thought, well, it's going to be more comfortable over there. And as soon as she spent one night there, she wanted to come home. And ironically, I guess maybe I wanted her to come home too, because it was her birthday, July 22nd. And so she came home for her birthday and stayed overnight. Clearly wasn't well. And she knew that. She knew she wasn't well. She wanted to go back now. We were no longer twisting her arm. She wanted to go back at SHEP 4. She said, I'm not doing well. I need to go back there. So she did go back. Of course, when she gets back there, she's like, what am I doing here? You know, all the same kind of stuff. But I kind of pushed, and maybe she stayed there a couple nights this time, but she's persuasive. She can kind of fake it really well, or could. And she convinced the doctors and myself to come home. And I had a busy weekend this upcoming weekend, and I called her sister and I said, look, I really need some support because I was having a little trouble getting like all close friends to get into the inner sanctum because Cheryl wanted this not to get out, you know, and she really didn't want, you know, what she thought the shame of it was to become public. And that to her was one of these worst case scenarios too. So, you know, even her going up there, she's like, what if somebody's going to find out, you know, and all of these things. And I'm like, we all have hard times and whatever. It doesn't matter, you know. Anyway, she came back home. Sister Kate flew from Chicago. It was a big weekend. And we probably dropped the ball on monitoring her. It wasn't long. There was one incident. She was whistling in the shower or humming in the shower. And I hadn't heard her do that for weeks. And you know what I now know is when a suicidal person gets a very strong determination to kill themselves, they actually get happy. And I didn't really know that. I guess maybe I'm an eternal optimist of some sort. And she was like, well, I want to go to yoga again. I'm home. I want to go to yoga. And I'm thinking, yoga, that's a good thing. You were just humming in the shower. Well, she didn't go to yoga that weekend morning. She went to the gun shop. And that same weekend, she shot herself. So that is pretty much my story in a nutshell. And I'm happy to answer questions.
Well, thank you very much.
Was there ever any look at the medication she was taking, that possibly some of these medication side effects are depression, suicidal thoughts, those kind of things? Was that ever looked at all?
I can only say that I think I'm aware of that. She was aware of that. I think it was discussed. I don't know how you look at it, and because you can't go down two different routes and compare them. So especially with stuff like that, where you need to get on the regimen for 2.5 weeks or something, even to begin to have some effect. The medication, I don't believe ever got really strong. But I can't really answer with any authority on that.
I just thought
other than that.
Ask. Thank you.
Paul, with what you know now, and knowing that we are looking at what, you know, we can do in legislation and policy work, knowing that we have a lot of activity in disparate agencies. We heard from Department of Health and from the Department of Mental Health, and there's, you know, things happening, but it seems to be all over the place. Mm-hmm. Do you have any recommendations for us of what would help prevent suicide in the future?
Well, you know, I was obviously thinking about this leading up to coming here, and sometimes I like to look at words and think about the linguistic meaning of words. And one thought that came to mind, and especially given the idea of impulsiveness or people who make quick decisions, is like you go mad. You know, when you go mad, we've all gotten mad, and it comes and it subsides. And we also know that depression sometimes is caused by anger, mad, internalized. Crimes of passion, where there's a brief period where one person's very angry. It may not even be suicide per se, but access to a firearm during these sort of, let's call them mini storms of emotion, seems easy access, that is, seems foolish to me. And so that's why I'm here, is because I would like to see some preventative legislation that allows people from impulsively inflicting harm on themselves or anyone else.
Thank you.
And feel free to tell me if you don't wish to share, because I'm wondering if you would share with us kind of how you are doing, how your children are doing. What year was this again?
2014.
2014. I'm interested in, making certain that people are aware that, a suicide doesn't just affect that person, that it sort of, I always call it a transfer of pain. Pain doesn't end, it just gets transferred on. And I wondered if you wouldn't mind how you are doing, how you have done, how your kids have coped, and
Well, for myself personally, I'm a little bit of a kind of person that always looks forward. Maybe I did it as a protection mechanism for myself, but I put on horse blinders right after this event, and that's kind of how I've dealt with it, or not dealt with it, if you even want to say that. But my life certainly has been void of catastrophe. I remember when this happened, I just turned 50, and I was thinking, bad. But my God, a lot of people have bad things happen. And so for me, I don't know, I'm okay. My daughter was around 10. And I remember when I was around 10, I was beginning to have that recognition that my parents weren't going to live forever. I remember crying myself to sleep with those thoughts. And sure enough, my daughter was doing the same thing. And I was in her bed comforting her around this time with those same types of emotions. I think any child from 10 to 13 or something, I don't know the exact age span, but it's going to damage them. It's going to really cause them some trouble. And she certainly has had some challenges. My son was maybe 7 at the time, and he's like, Mom did what? She was like, she understood it immediately and burst out screaming. So he seems to be not so affected, but we're all affected. Not a day or week goes by where I don't think about it. It's like a bad accident you had or something. It just leaves a scar. It's there. It's part of who you are. It changes you forever. But like I said, I put my horse blinders on, and that's just what I've done. Life is a gift to me, and I don't want to see my gift ruined by some really unfortunate circumstances, Yeah, my daughter is in art school, and most of her art is about her mother, previous to her suicide. And it can be frustrating, even though, I actually took the kids to art therapists soon after under the warm suggestion of some close friends. And the kids hated it. They were like, we don't want to be different. We know this thing happened to us, but we just want to be like all the other kids. And they didn't partake in that. And the irony is now that's what my daughter does with her 4-year higher education degree, but that's not it.
Thanks. I appreciate you sharing that with us.
Sure.
Anything else from anyone?
Good luck.
Thanks. Thank you.
Thank you very much. Go ahead, Rob.
Well, I can say I had a lot of positive memories of Cheryl and her commentaries on the Vermont Public Radio. And I learned a lot from her, so I was shocked.
That's something that's lost, right? It's not just that the immediate people, but as a society, and we saw that in her funeral, the place was full house. As a community, sadly, we really lost a lot.
Thank you again. We can't thank you enough for sharing your story with us, and
Thank
taking
you.
the time.
Sure. Well, I appreciate all the work you guys do.